Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today in our election series, a look at where the presidential candidates stand on protecting the public's health and how each might impact the work of the CDC, the FDA, the EPA, and other federal agencies. Stephanie Desmond talks to Dr. Georges Benjamin, longtime executive director of the American Public Health Association, about what federal agencies charged with keeping people safe in emergencies and every day could look like after the 2024 election. Let's listen.
Georges Benjamin, thanks so much for joining me.
Thanks for having me.
So we're doing an election series, and today I wanted to talk to you about what this election could mean for the public's health. And I was hoping we could talk about how the different candidates would approach different issues facing our federal agencies, such as the NIH, the EPA, FTC, and CDC. And I'm wondering how you see all of this.
Well, you know, what I do is I kind of think about the broad issues about what a particular administration brings to the table. So I think about who they will appoint in various jobs. So personnel is policy, very much so. I think about what their perspective is on funding, what their funding priorities is. Your budget is your priority document. And I think about how they think about problem solving. How do they approach problems? Do they use their ideology? We all use what we believe to drive things, but do they use their ideology in an overwhelming way and ignore the evidence and science around things as a major part of the decision making? Or do they just kind of shoot from the hip? When you think about those three core areas, I think we have stark differences in the candidates that we have to vote for this year.
I come from a science background myself, and so I've always been concerned sort of about the lack of trust in the evidence that has emerged in recent years. And I'm wondering what kind of role that plays, and could you maybe contrast the two candidates we're seeing?
It's how you approach problems. And, we talk about medicine, for example, being both an art and a science. And there are clearly things that work. You can't quite explain why they work, and that's why we do things. And that's okay. Practice and experience are very, very important. But there are just some fundamentals around science and evidence that we've developed over the years that are important. So we know that certainly the Harris administration, should she be elected, has a history of engaging people. And we look at who she's appointed. Her and President Biden have appointed in their current administration. These people tend to have been highly competent, qualified, et cetera. Their policies on the finance side have been proactive in terms of promoting health and clearly using science and evidence to make problem solving. On the same token, we have experience with the Trump administration. And while the president did appoint some really competent people in his administration, he often didn't let them do their thing. And so while personnel is certainly policy, having people that have the fortitude to implement good, sound policy is important, even if they're highly academically qualified. We also know that at least the House of Representatives, in the budget proposals that they put on the table, should they be enacted, would dramatically reduce funding for almost all of the things in science that we care about. Almost all the public agencies, all the front-leaning programs for every one of these agencies, and not just simply capping them at some low growth level, but really dramatic reductions in their funding. So, and I think we also have the experience, although mixed, in the Trump administration, where they did a phenomenal thing with Operation Warp Speed to getting the vaccine in place. But in terms of implementing a response to COVID, really did a terrible job of it.
So that really makes me want to ask you about the Centers for Disease Control and Prevention, the CDC. They took a real reputational blow during the COVID pandemic. And I have seen Project 2025, which is this blueprint for Trump's second term, it would dramatically cut the CDC. What will that look like?
Well, we have to look at what that proposal, Project 2025, proposes. They make the argument that we ought to strengthen the CDC by strengthening its infectious disease capacity. On the other hand, that's not what they're really trying to do. That's a red flag. They're taking the nation's prevention agency apart. They want to outsource many of the entities that are in CDC and other places, or get rid of them. So things like climate change, firearm research and prevention activities, chronic disease activities, they want to outsource those out to other agencies whose fundamental role is in prevention. And our experience has been when we're told that people want to strengthen an agency and they want to reduce its focus, what they often do is reduce its focus, underfund it, and then not fund the things that they send to other places. They have them just kind of absorb it. And we've seen that before. We saw that during the Reagan administration when President Reagan created the Preventive Health Block Grant. And what they said was, we're going to strengthen the flexibility to deal with all these prevention activities. And they put them all under one funding stream and then cut it by 20% as an efficiency cut. And then, of course, that funding stream lost its identity. And while it is still the only flexible funding that we have in public health that really goes out on an annual basis, it's only about $100 million now, and it gets cut. And by the way, it gets cut by both parties, just because people don't really understand what it's for. But that funding stream has been used to fund public health emergencies. When we had West Nile virus, it was funding we could move around. Ebola, it was money we could move around. Climate change is money we could move around. So while it did give the flexibility that it was said it should do, the amount of money on the table to do it dramatically reduced, and its effectiveness in many ways under the individual funding streams were lost.
What happens under a weak CDC?
Well, I'm going to be really clear. I think CDC is the nation's prevention agency. And under a weak CDC, we won't have anyone really doing prevention. If they made it really robust and added the funding that it needed and strengthened the data reporting requirements and build a health information technology system so that we could share data quickly and make sound data-driven decisions, and every time we had a new and emerging disease, invested in our ability to address it, that would be a great benefit. But what we would lose is the leading causes of death being focused on. So while we have influenza every year and a major pandemic every 50 to 100 years, the things that really kill people, heart disease, strokes, cancer, would be dramatically underinvested in on the prevention side of the equation.
Let's talk about the FDA. We've seen what a Trump administration looks like with the FDA, and we see what how the Biden administration is different, and Kamala Harris, in many ways, is sort of sticking with what has worked for the Biden administration. What does the FDA look like under, a future presidency?
Well, our experience with the Trump administration was Scott Gottlieb was there, and he was a very good FDA commissioner. He was very strong on tobacco. He's a good administrator, smart guy. And of course, the current FDA commissioner is very competent and a smart guy. So in both administrations, we've had decent FDA commissioners for sure. But the approach to the fact that the FDA regulates such a large part of our economy and a bunch of underlying tremors in our society, where we've now got the Chevron decision by the Supreme Court, which allows for the undermining of administrative authority. I would be very concerned about an administrative agency like the FDA, which historically has been underfunded dramatically, but lots of potential authority and regulates conceptually so much of our economy, having its decisions second-guessed by the courts. And an administration that my view would be, under the Trump administration, would be more likely to defer to the courts and not so eager to defend the administrative regulatory needs that we have. I don't necessarily believe that we should regulate everything by any means, but we need to have the regulations that we do need to have, and we need to lessen the regulations that we don't need to have and make sure that they provide the kind of support, sometimes to level the playing field from a regulatory perspective. And if we pulled a lot of these regulations today away, which like we did see with EPA, the food would not be safe to eat, the water would not be safe to drink, and the air wouldn't be safe to breathe. And we have experience with the Trump administration with their view that the private sector knows best and we should deregulate as much as we can. The problem is that the private sector has not shown, in my mind, often the ability to be responsible in some of these areas. And so when that happens, we lose the ability to put in place procedures, regs to protect the public's health in a meaningful way. And for those communities that are more dependent on being protected, meaning underserved communities, low-income communities, those communities who are already disproportionately impacted by a range of environmental threats, a range of health threats, have a disproportionate health burden, they would disproportionately be, frankly, injured by not being more thoughtful about our regulatory apparatus and who we put in those jobs.
I don't know. It feels like a no-brainer to me that the public's health should be sort of utmost concern for voters. And we have a real striking contrast here about our choice when it comes to just basic things. Like you said, is our food safe? Is our water safe? Is our air safe to breathe?
One of the things we've got to do a better job in public health, we often talk about the good things that we've done. But of course, when our best work is done, nothing happens. And so we don't get credit for that. And I think our task for the next several years in public health is to make public health more valued and viewed as a best buy in the public's mind. And what I mean by that is we don't have, fortunately, a lot of fires. We've done a lot of really good things to reduce the risk of structural fires in our country. And yet, one of the strongest caucuses in Congress is the fire caucus. Every year, the men and women of our fire departments go up on the Hill in uniform and shake the hands of their members of Congress. And they value them, even though the structural fires have dramatically reduced. But they also now do EMS, and they're also valued for their emergency medical response. I know that because I actually ran the EMS system for DC for a while. And I can tell you how highly valued we were in the community. And yet often the public health people were not as valued, even though we offered lots of public health protections. A lot of things we did were silent, and we protected the public just as much as my fire department and even my police friends that we worked alongside. And yet we weren't as valued often by the public.
Do you see one candidate valuing public health over the other?
Oh, I actually think that, we're going to see, just because of the approach of the Harris administration to health as part of their agenda, we don't have yet a health agenda from the Trump administration. We do have it both on the Biden-Harris record, but also we know that, at least so far, the Harris administration has taken an evidence-based approach to problem solving and articulate that all the time. And we've not yet seen that. I think the other concern we have, of course, is some of the people hovering around Trump's campaign. RFK, for example, no problem. He's not been evidence-based in his approach. He was a pretty good advocacy attorney on the environment, but his anti-vaccine stance are not acceptable.
George Benjamin, thank you so much for sharing your insight.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.